Why is pancreatic cyst surveillance so frequent? Imagine discovering a tiny bubble in your pancreas during an unrelated scan. It might seem small and harmless, but doctors keep a close eye on these cysts because their behavior can change over time. Pancreatic cysts are incredibly diverse. Some stay the same for years, while others can develop into pancreatic cancer, which is known for being very aggressive and hard to treat. Because of this, regular monitoring becomes essential to catch any early signs of trouble. Many cysts are found incidentally when imaging tests like MRI or computed tomography scans are done for other health issues. Most of these cysts are benign or low risk, but certain types, like intraductal papillary mucinous neoplasms, or IPMs, carry a small chance of turning into cancer. Since it's difficult to predict which cysts will become problematic, doctors follow a cautious approach, scheduling frequent checkups to watch for any changes. The frequency of surveillance depends on the size and features of the cyst. Small cysts less than 1.5 centimeters without concerning traits might be checked once a year with imaging. If the cyst is between 1.5 and 2.5 centimeters or shows communication with the main pancreatic duct, doctors may recommend follow-up every 6 to 12 months. They might also perform endoscopic ultrasound and analyze fluid from the cyst to assess cancer risk. Larger cysts over 2.5 centimeters or those with suspicious features like solid parts or duct dilation requiring even closer monitoring, sometimes every 3 to 6 months. These cases might lead to discussions about surgery, especially if high-risk signs are present. Surveillance often continues for many years because some cysts stay stable for a long time but still have the potential to become cancerous later. Guidelines usually recommend ongoing monitoring for up to 10 years or more, especially if the cyst remains unchanged. Factors like age, overall health, and whether a person is a good candidate for surgery also influence how often surveillance is done. For older adults or those with other health issues, doctors might adjust or even stop monitoring if the risks outweigh the benefits. In summary, pancreatic cyst surveillance is so frequent because pancreatic cancer is often diagnosed late when it is harder to treat. Early detection of changes in cysts can save lives. Since initial imaging can't always tell us which cyst will turn dangerous, regular follow-up helps catch problems early. Monitoring intervals are tailored to each person's specific cyst features and health status, balancing the need for vigilance with the goal of avoiding unnecessary procedures. Following these guidelines helps protect pancreas health and reduces the risk of pancreatic cancer developing unnoticed. Always remember to discuss your individual situation with your healthcare provider for personalized advice.